patient and their support structure about what was going on. So what we did is we really left the patient and their family behind in an effort to industrialize healthcare and advance our efforts in research and treating disease. So when you really look at the overall landscape, about 18% of the gross national product is in healthcare, about $2.8 trillion. The Institutes of Medicine did a study last year and said, of all the latest data, which was about 2009, they said we wasted about $750 billion. So those are a lot of dollars, and then the question is where did it get wasted and how? Because there's leaks in the system, because we order 32% of all the tests are reorders. It doesn't stick. We have problems in communicating. We have problems in saying what we're telling a patient to be effectively communicated to their family, to other physicians. We really have a communication problem in healthcare. And when you look at it through the lens of communication, it's not so complicated anymore. Because just like these PowerPoints are going to convey something to you, if you get to take a copy of it home, you're going to remember more about what I said. But when you're a patient and you leave the exam room and you didn't take notes, how do you tell your family, or how do you tell your wife what the pediatrician said? So we really have a communication problem. So the question is, how do we fix that, or even is this the time to fix that? And I would say it's a great time to fix that. And the reason we couldn't fix it years before is because we didn't really have enough of the incentives or the infrastructure to do so. And think about what we have, unprecedented right now. We have three major forces that are creating a perfect storm. One is we have Obamacare, PPACA, health reform, whatever name you want to give it. We have the government coming in at an unprecedented level, even more than what they did when we tried to create a social safety net called Medicare. It's huge. And so there are a lot of people who are very anxious about how they respond to that, including patients, in which 93 million patients this year will change insurance providers. Or insurance payers, which means they'll get new providers, which means they're going to be a new patient to a whole bunch of doctors this year. And look at this, age of consumerism. Dude, if we don't like your product, we give it 1 star on Amazon. If we don't like your restaurant, we downvote it. We don't like where you are, we don't check in. The age of consumerism has created this attitude of saying, look, we have a vote, and we have a vote that goes beyond just our dollars, as capitalism structure said how the system should be, but now we have a way to communicate our vote digitally. And so this creates expectations, which is really butting up against the vanguard in healthcare. And then lastly, I don't think there's probably but maybe 5 people in this room who don't have a smartphone. I lost my cell phone or my smartphone last year. I went directly to an AT&T store and got another one because we are so plugged in that we can't live without the things. And so when you have all these things that are sort of coalescing, people are saying you're getting sicker. I don't understand what you said. My wife's got cancer. My mother is sick. My kids have a fever. How do I sit there and be a real part of that solution? So this is what we did. We created a communications platform that does this. We created a patient-centered engagement platform that really solves for the communication problems in healthcare. Basically what we did is we created a platform for collaboration. And what we did is we're leapfrogging what other institutions have been trying to do to advance providers and hospitals. We're going directly to the patient and using the federal power that they have under HIPAA to get all of the records. Because if you really want the whole story, you need it from the patient. But you got to give a patient an audience. You have to give them the ability to collaborate. Just like Oracle, just like SAP, just like Salesforce, all these tools have made it business in the enterprise to allow employees to work together on behalf of the client, to deliver faster, better attention. We need the same thing in healthcare. And so what results would we see when we get these environments of collaboration, when we increase the confidence of patients? Let them be informed. They gave you the content, but they didn't increase the confidence about now how you interact with your provider. And so providers became really disenfranchised with the way they care because it doesn't really sound like they're very interested in what you're saying. And so look at the 3 things that we really do with CareSync. One is we improve clinical outcomes because now people and their families are engaged, they can consume and collaborate. Another thing is we drive costs down. When providers have the data at the point of care, they deliver better care, they order less tests, and help with the gaps in regulatory compliance. So, do I know what I'm talking about? Do we have a team of people, or is this just some of the hopes and dreams of 2 kids in a pizza box? It's not. Our last company exited for $45 million in this space because we created something that no one ever thought about. Let's go ahead and create an EMR and a practice management system in the browser, what you now would call the cloud. In 2003, the word cloud wasn't even around. We did that. We were acquired by Eclipsys in 2009 and then later by Allscripts. We've invested $8 million in 2 years of building this platform with the same team that built Bond Technologies and exited. We're selling to the enterprise and to the consumer. You go and sign up on it with a credit card, build your family, get your records. We'll help you coordinate your care, do a lot of wonderful things for you, but we'll empower you in a place where you can collaborate that. We have 3 verbal commitments from national payers in a specialty hospital because they have things like readmission penalties. They have problems because they're trying to do virtual case management. They need ways to communicate with their members and their family. We're projecting $6 million this year and $47 million next. And our revenue model comes from different places, like the fees and services that we do in the data that we can sell. We're seeking $10 million, and we believe that we've identified about 5. $10 million gets us to break even, as well as it allows us to go to the national sales and marketing campaigns. And please visit us and move